morning show, and it's now time for the big story. The Jamaica Medical Doctors Association, the JMDA, is in a significant dispute with the Ministry of Health and Wellness over overtime pay for doctors. The dispute, which could cost the government some over 100 billion Jamaican dollars, has been brought before the Industrial Disputes Tribunal, the IDT. All right, I think we have our guests. I think we have them holding, so I'll get to them momentarily. Yeah. So the JMDA is seeking retroactive payments from dating back to April 2023, while the government is proposing payments starting August 2024. You see the problem, right? The outcome of this case could have substantial implications for the healthcare system and for the government's finances. It is a topical issue and one we think is important enough for us to have not one but two doctors on to talk with me this morning. We have Dr. Renee Bardoe, and she is the president of the Jamaica Medical Doctors Association. Good morning, Dr. Bardoe. How are you today? Are you there, Doc? Let me try again. Dr. Bardoe, are you there? Hi, Dr. Bardoe, are you there?
Hi, good morning. Yes, I'm here.
Good morning. We're hearing you now. And I also want to welcome the second Vice President of the JMDA, Dr. Damion Harvey. Good morning, Dr. Harvey.
Good morning.
Thank you so much for joining us. All right. Let me go to Madam President first of all. What would you say are the key issues that's driving this dispute over overtime pay for doctors, and how have the negotiations with the government been progressing so far, Doc?
Well, the key issue is that the government of Jamaica has not honored its agreement with the JMDA. The Ministry of Finance has basically sought to tear up an already signed contract. To make matters worse, the Ministries of Finance and Health has even asked the Minister of Labour to tear up or to redact his terms of reference, for which a dispute that we're currently having is to be settled by the IDT. But luckily, good sense prevailed, or we'd be having a really different interview today.
So you do have copies of the contract?
Yes, we do. From 2023.
Yes. So the government
and it is that contract.
Go ahead, Doc.
And it is that contract that the government has not honored.
Now, how do you respond to the government's claim that implementing the JMDA's proposed extra hours worked policy could cost over 103 billion Jamaican dollars annually? Are those factual information?
Dr. Harvey?
Well, the first assumption that we have to make is whether the Ministry of Finance costing makes sense or not. Based on the brief that the government of Jamaica has submitted, they have admitted to a cost of $103.8 billion per annum. And that would mean that they have created a budget and that they made provisions for that $103.8 billion to be paid for overtime to doctors. The question that Jamaica, though, has asked the Minister of Finance is whether in their recent budget presentation was that $103.8 billion mentioned or allocated. The next question, though, that needs to be asked seriously is where did that figure come from and how did they come up with that calculation? Is it that the Finance Ministry believes that Jamaicans are unable to do basic reasoning and use a calculator to do basic maths? Because my basic math says that if you take $103.8 billion, divide it by 12 months, divided by the number of doctors they have allocated it for of 2,143 is $3.8 million in overtime per doctor per month. We should imply that they're either stupid, money hungry, greedy in our current fiscal situation that we would want more than $3.8 million in overtime per month. And we are willing to go on national radio and TV and newspaper and disrupt the health sector just for that and more than that.
So it is obvious that you don't buy the argument of the 103.8 billion that is being put forward by the ministry.
No, it's nowhere near 103.8 billion, and it's not even half of that.
Okay. Can you be more specific though? Like what are your calculations showing? Approximately.
So our calculations is based on that is less than half.
Less than half. So that would be somewhere in the region of 40 odd billion.
Yes.
Or thereabouts. Madam President, Dr. Bardoe, what are the implications of the government's proposal to start payments from August 2024 rather than retroactively from April 2023? Because that's a sticking point, it seems.
What basically the ministry is saying to us is that they are not willing to stand by a contract. They're willing to tear up a 2023 agreement, and the doctors have already worked these hours. We have been working in good faith for this would be more than 2 years now, and the government basically is showing us bad faith in our negotiations and really how disingenuous they have been to the doctors, because I'm not sure how anybody in Jamaica would feel to be working for 2 years and being underpaid for those 2 years. And every time the ministry says, let's push back. We soon sort it out. And all know it hasn't been sorted. As a Jamaican, you have to be concerned if this is how the government is treating its professionals.
You know, this story has taken a lot of people by surprise because apparently, for the most part, the doctors have been fairly quiet, working behind the scenes, trying to negotiate it, I would imagine, but not saying much publicly. And so when the public started hearing about this 103.8 billion, it took everybody by surprise. But I'd like to ask Dr. Harvey, how has this dispute now affected the medical profession in terms of doctors in the rural areas, in terms of patient care, and so on? How is it impacting the doctors and their work?
Well, in order to answer that question, we have to first establish and understand how doctors work. So, emergencies and patients don't actually happen between regular hours of work of 8 to 4 p.m. or 9 to 5. Hospitals have to be open 24 hours a day, 7 days a week, 365 days for the year. And since there are 24 hours in a day, if you divide 24 hours by regular 8 hours of work, that is supposed to be 3 shifts for the day, or that would be 3 shifts for the day. Unfortunately, we don't have a complement of doctors to cover 3 shifts for the day. So what ends up happening is that in order to ensure that there is continuity of coverage, we end up doing overtime or additional hours, or what in our profession we call emergency duty.
Yes.
And since 1992, based off agreement, this overtime is mandatory. So for over 2,000 of us, we have no choice and we can't opt out of it. The only time you can probably not schedule for overtime is when you're on vacation, and they have the right to call you from your vacation if they have insufficient staff to cover.
Is it so bad that sometimes the doctors have to do like a double shift, like 16 hours?
Yes, or 24 hours.
What?
Or no, sometimes we do, no, Damion, remember we also do 80 hours consecutively. Because there are some doctors that we work from Friday morning straight until Monday evening, and that is 80 consecutive hours of work.
Oh, I'm not a doctor, obviously, but even that doesn't sound like it's a healthy arrangement, Dr. Bardoe, in all honesty. Suffering from...
That is how some of us work.
Yes, yes. I mean, we thank you for the efforts, but that I can see a burnout situation taking place. In the discussions, I want to get an idea, Madam President, as to how far off are you from the government? I mean, like, I'm trying to picture whether or not there will be some finality soon because you're not too far apart. Have you made any compromises in your negotiations to try to settle the issue, and why have these been rejected, so to speak?
Well, the compromises we have made to the government, because when we looked at what the government was proposing, we were simply saying that this cannot work. Now, I think just to answer further for the question with regards to the doctors in rural Jamaica, the doctors in rural Jamaica work in an understaffed, under-resourced, even less resources than the urban centers. Hospitals, right? They have to do overtime more frequently than doctors in the urban centers. And not only do they have to do duties more frequently, they also have to cross different specialties. So, for example, you have a doctor that has to be working 1 minute in pediatrics, and then the next minute that doctor has to be going scrubbing in and doing surgery to take out an appendix. So that kind of relationship and crossing specialties doesn't happen in urban centers, because we recognize that when you have to jump from one specialty to the other specialty, that increases the medical legal risk to the doctor. And in addition, that's not how it is in urban centers in type A and B hospitals, right? So these doctors, they have increased medical legal risk and responsibilities. They have increased workload because they're understaffed, and they have less resources than that is which present in types A and B hospital, right?
Yes.
Now we are saying to the government that your proposal, you parade this proposal, it should be fair, it should be equitable, and it should be transparent.
Right.
Fine, no problem. But the doctors don't work the same. You have not changed how our doctors have worked, right? Our doctors are still understaffed. They still lack resources. You cannot pay the doctor that works in an urban center with more resources and more human resources and more doctors on their team the same as a doctor who is doing 4 persons work in a rural hospital. What you're going to have is going to mash up the health sector. You're going to have now doctors who are going to say, okay, I'm going to leave here and go back. A lot of them, some of them, they actually come from urban centers to service Jamaica in the rural areas, right? They're going to go back to urban centers and get the same amount of money, but less amount of work. And that cannot work. You cannot pay the person who's doing 4 persons' work the same as the person who's doing 1 person's work. And we keep on saying to the government that this proposal does not make sense. Another thing that they do for the doctors is that you have one doctor going like a circuit from one hospital to the next hospital all over the place. They move from KPH to Buster to National Chest to Hope Institute. They come back down, they go around in a circuit. And we're saying to them, the doctor that is moving all over the place and responsible for patients in so many different hospitals cannot make the same amount of money as a doctor who's only in one hospital for one set of patients. Right? And the reason this circuit and this moving up and down in a circuit is happening because you don't have enough doctors to service the system. Right? So all we're saying, we're not even fighting for the majority, as JMDA, we're fighting for the minority. We're fighting for our colleagues who we know that their workload is different than the workload of a doctor in one hospital in an urban center. It cannot be the same. It's not fair, it's not equitable, and you're going to mash up the health sector. People are going to leave. And who is going to suffer? The poor.
Yeah.
Who is going to suffer? The persons in the rural areas. You cannot do that.
Okay. Dr. Harvey, now that you've taken this matter, very serious matter, it sounds like, to the IDT, what are your expectations for the outcome of this dispute? And by extension, what steps will be taken if a resolution is not reached?
So the the IDT will rule based on the evidence that is submitted by both parties. It is expected that the government has payments to be made to doctors, but based off the 2023 MOU that was signed, they're trying to renege on honoring the full payments that would be due to the doctors. And the IDT rule, it is usually binding on the parties, so it is the onus is on the parties to honor the ruling of the IDT.
Mm-hmm. Whatever that is.
Yes.
Yes. Well, we're pretty much out of time, but I just wanted to get a final comment from the president, Dr. Renee Bardoe. In terms of, Doc, the long-term implications of this dispute on the healthcare system in Jamaica, are you hopeful? Are you willing to make any further concessions? Are you hopeful that this will be resolved very, very soon and amicably?
We are very hopeful because we have a very strong case. We have our evidence. We have our witnesses lined up. We have a very strong case. And we hope that good sense will prevail. The IDT, the panel, they will hear what we have to say and the implications of what the Ministry of Finance and the Ministry of Health is, what implications of their proposal will be on the health sector, how the national interest will be affected. We hope that they will take evidence into serious consideration and to provide a ruling that is just, that is fair, and it will be for the betterment of our country.
Dr. Renee Bardoe and Dr. Damion Harvey, thank you so much for availing yourselves and speaking with us this morning on this very, very important issue. And we'll definitely continue to monitor it, and we hope that there will be a resolution in the very near future. Thank you so much, and have a good day.
Thank you for having us.
All right. Take care. Have a good one. Thank you.